Monkeypox is a DNA virus that's commonly found in parts of West and Central Africa. And although it's called monkeypox, primates aren't actually its natural host. We don't know what species it's normally found in, but it's associated with large rodents. And it's not that closely related to smallpox. There's thousands of years of evolution in between these two viruses.
Why are these latest cases around the world raising concern?
One of the things that's worrying people is that monkeypox is often thought of as not very successfully spread from person to person. When we see cases outside West and Central Africa, they're normally associated with travel history. And what's different here is that many of the individuals, for example, identified in the United Kingdom, don't have recent travel history to Africa. And that's one of the things that has worried epidemiologists in the UK.
How do we know if we've got monkeypox?
The initial symptoms of monkeypox are quite similar to many other viruses, for example, a fever, feeling unwell, swollen lymph nodes, but then it does cause a quite characteristic rash, and that might appear first on the face, the groin area, or the hands and feet. And it's the appearance of the rash that's been driving people to seek healthcare, and that's how these cases have been identified.
How infectious is it, is what we're all asking, and the way that it's transmitted, has that evolved over time?
It's not as infectious as, for example, COVID or measles. When we talk about the R value, which I think we've all become familiar with over the last few years, the R value for monkeypox is 2, and that means that we would expect each case to go on to infect 2 more people. So it's not as infectious as COVID. However, it is spread by close bodily contact, sharing bedding, sharing clothing. It can be spread by coughs and sneezes, but it is really that close physical contact, for example, in households or with sexual partners, that's the biggest risk for transmission. And that's probably where the sexual transmission that we think has been seen in the UK recently and elsewhere has come from, because you're getting close bodily contact for prolonged periods of time, and that's ideal for the transmission of this virus.
There is an approved vaccine for it. How effective is it, and who should be getting it?
There's a licensed vaccine, which is the traditional smallpox vaccine, and then there's a new, safer vaccine being tested, as you say. They're highly effective, particularly if given before exposure, but they can also be given as prophylaxis after exposure, up to 4 days after exposure, and then they're 85% effective. There's a lot of interest in making sure that healthcare workers are given protection, but because some of the smallpox vaccines, particularly the older one, can have side effects, it's not always given to the general population, but given to people who are at particular risk because of occupational exposure. So that would be doctors and nurses.
And Charlotte, what comparisons can be made to the virus we have become so familiar with? You mentioned earlier COVID-19.
One thing I would say is that monkeypox is made of DNA rather than RNA, so that's a major difference to COVID. And what that means is that monkeypox virus does not evolve as fast as COVID. So we wouldn't expect to see multiple waves of new variants arriving around the world very rapidly. And it also spreads more slowly with a longer incubation period. And that's really to our advantage. It's to the advantage of public health and epidemiology, because it means there's time to track people down who might have contracted monkeypox and encourage them to isolate before they become infectious to others. On the other side, it is unfortunately infectious for a much longer period than COVID. So when people have lesions, they are infectious until those lesions blister, scab over and completely dry up, and that can take up to 4 weeks.
Are there people who are more susceptible to the disease than others? What pattern are we seeing?
We have seen epidemiological links in Europe, particularly both to travel history to West Africa recently, but also in the community of gay, bisexual and men who have sex with men. So they're one population where there's a lot of information being shared at the moment to make sure that people know the symptoms, know what the risks are so that they can protect themselves, and so that if they do show symptoms, they can seek out appropriate healthcare early to make sure that this infection doesn't spread more broadly. One thing I would say is that this is the West African strain of monkeypox, so it has a lower mortality rate than other strains of monkeypox. And when we've seen outbreaks in the past in the USA, for example, the mortality rate has been very low, so that's something that's in our favour.
What are the priorities for scientists investigating this situation at the moment? When do you think they might get a little bit more worried?
It's very hard to tell at the moment whether the increased transmission that we've seen on multiple continents is the result of one transmission event or a broader, what we call spillover of this virus into humans. So scientists will be wanting to make sure that the incubation period is still the one that we've identified in cases in the past. And they'll be looking at the genetic code of the virus to see whether it's spreading more easily person to person. And they'll also be making sure that the symptom profile hasn't changed, so that we make sure that doctors and nurses, healthcare professionals, are looking for the right kinds of symptoms in patients who are at higher risk.
So Charlotte, on a scale of 1 to 10 then, how concerned should we be about monkeypox?
I think we're perhaps a 3 out of 10. I would say I personally am a 3 out of 10. We have factors working in our favour, like we already have tests, treatments and safe and effective vaccines, which puts us months ahead of where we were with COVID-19. But there is some worry that because this has popped up on multiple continents in a very short time period, we might be looking at something like a slightly shorter incubation period than we're used to, and that would make it harder to do things like contact tracing. It just makes the job of epidemiologists harder. So we really need to get on top of some of the facts of this most recent outbreak, and that will then tell us how worried we need to be and how fast we need to move.
Okay, well, we have learnt a lot from COVID already, and hopefully we can apply that to future circumstances. Charlotte, thank you so much for your time.
Thanks for having me.